أو يتوب عليهم إن الله كان غفورا رحيما. ورد الله الذين كفروا بغيظهم لم ينالوا خيرا وكفى الله المؤمنين القتال وكان الله قويا عزيزا. وأنزل الذين ظاهروهم من أهل الكتاب من صياصيهم وقذف في قلوبهم الرعب فريقا تقتلون وتأسرون فريقا وأورثكم أرضهم وديارهم وأموالهم وأرضا لم تطئوها وكان الله على كل شيء قديرا. يا أيها النبي قل لأزواجك إن كنتن تردن الحياة الدنيا وزينتها فتعالين أمتعكن وأسرحكن سراحا جميلا. وإن كنتن تردن الله ورسوله والدار الآخرة فإن الله أعد للمحسنات منكن أجرا عظيما. صدق الله العظيم.
صدق الله العظيم وبلغ رسول الكريم ونحن على ذلك من الشاهدين والشاكرين. I'll give thanks to Almighty Allah subhanahu wa ta'ala to make it easy for our brothers to give us the opening prayer and the opening recitation. May Allah subhanahu wa ta'ala accept it from them. And those of us that are listening attentively to, may Allah subhanahu wa ta'ala put it in the scale of our good deeds. Without wasting our time, we'll move on to the introduction of guests for today's program. We have the chairman of today's occasion, being one of our brothers, he is one time the National Secretary of Association of Radiographers of Nigeria, and presently he is the President, Association of Radiographers of Nigeria. He is also a senior lecturer with the Department of Medical Radiography, Bayero University, Kano. Please kindly join me to welcome our chairman for today. He's no other person than Dr. Musa Yusuf Dambele. Please kindly say Teslim to the house. Dr. Musa Dambele, I can see you. You are with us. Please kindly say Teslim to the house. Okay. We'll move to the next person, and that's our father of today's. Is one of our malams. He is our mentor, and by coincidence, is also a radiographer. And in his own case, he is a WHO recognized radiographer. We are not talking. We are talking of no other person than Al-Haj Isiaq Omo Bolaji Sabah. Assalamu alaikum takatusa. Please say testing to the house.
Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. We also recognize each and every one of us that are present. You are indeed all unique to us. Every one of us, we can't be mentioning our names one after the other because of time, but we welcome you all to this program. Now, I would like to move on to the lecturers of today's program, who will be taking us through the topic, the lower back pain. He is no other person than our brother in faith. He is a consultant orthopedic and a trauma surgeon from the National Orthopedic Hospital, Igbobi, Lagos. He is no other person than Dr. Ahmad Oshundina. Please kindly say Teslim to the house.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa barakatuh. We are happy to have you with us, and within 40 minutes, we want you to quickly take us through your presentation. So hand over the invisible mic to you, sir. Thank you so much.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa
Alaikum
rahmatullahi wa
salam wa
barakatuh.
rahmatullahi wa barakatuh.
Yeah. So the topic of discussion this evening is low back pain. Low back pain. The reason why we have a distinction for low back. Why low back? Why not say back pain? The reason why there's a distinction is the back is divided into three. The back is divided into three: the upper part, the middle part, and the lower part. So you can have the back pain, which is the neck pain. Then we can have the mid back. Mid back is the area that is we can say is part of the thorax. I'm sure we are all conversant with what I mean by thorax, the torso.
Yeah. Yes.
And then the lower ball, the lower part, which is the lowest part, which we call the low back, is the area below the lowest rib down to the lowest part of the buttock. So whichever pain anybody has below the rib at the back to the lowest part of the buttock is a low back pain. It's a big area. It's a very wide area. And what constitutes these parts? We have the skin, we have the subcutaneous layer, which we call the fat layer, and they have muscles, we have ligaments, we have tendons, we have nerves, we have vessels, that is artery and vein, and we have nerves also there. And we have bone, the one we call vertebral column. And mainly around this area, we have what we call the lumbar vertebra, and then the sacral bones. So essentially, those are the structures in this area. From all these structures, pain can be generated. Pain can be generated from bone. Pain can be generated from skin. Pain can be generated from muscle, from ligaments, from nerves. So when we say low back pain, what we are actually saying is that this person has pain from this region that I've described, which can be from any of those structures that I've discussed, that I've just told us. And if I'm going to tell you to discuss the disease that can cause that, it's more than 1,000. So, but we'll try and simplify it so that it can be very clear to us. Now, what are the risk factors that brings about this? I hope everybody's with me. Assalamu alaikum.
We are with you, sir.
Okay, so what are the risk factors? From my experience, one of the most common factor that causes pain in this area of the body is people that are exposed to sedentary jobs. Sedentary jobs. You may be an executive, a secretary, a typist, a teacher. You might be a long-distance driver or long-distance trader. You might be a side road trader, somebody that sells akara. Once she comes to a shop in the morning, she sits there for hours, to say 6 o'clock, from 8 o'clock in the morning. And she does this for 15, 20 years without her knowing she's already causing problem for that back. We'll get to that later. Though we will not leave out people like computer analysts who also sits using their laptops for hours. So that's one group of people. Another group of people that suffers this syndromic disease that we're talking about, the people who lift weights, weightlifters. Weightlifters, I mean, it can be as a result of athleticism. You are lifting weights to build muscle. You may be a bricklayer or somebody that carries heavy load. Maybe a mechanic that carries engine of cars, or you may be a farmer. Yeah, bending the back. So for so many years, you bend back for so many hours in a day for so many years. All these things, they cause problems to the low back. Also, if somebody is in the habit of taking steroids in different forms, what I mean by that is sometimes it may be a tablet. People are very fond of taking this poisonous tablet. We call it prednisolone. Prednisolone, very common in town. People take it. Some ladies take it because they want to put on weight. They call it prednisone. They call it all different types of names. So because they want to put on weight, some ladies take it. It destroys bone, destroys cartilage. So apart from that, it may not be oral injection of steroid. It may be cream. So like ladies who changes their skin, who bleaches their skin. Even men nowadays, we now see men who bleaches their skin. So people in this category also, they are prone to having low back pain. And what the steroid does is it destroys the cartilage, it destroys the bone, so that their bones are soft. A term we call osteoporosis. So they generate pain from the bones. Also, ladies who have stopped menses, menopausal ladies, postmenopausal ladies, they also can have osteoporosis because estrogen is no more being formed, and so the bones become softer, and they have lots of pain from the lower back. A patient that undergoes removal of ovary, the two ovaries, can also suffer from this type of problem. Is there any age group that suffers low back pain? Really, there is no age group that is specific for it. Very common across all age groups. But it is most seen in the older age brackets, say from 50 years and above. I will talk more of that later. Sex ratio, yeah, it's more in female than male because of this additional factor that we have discussed. It may be hormonal problem, like the estrogen we have talked about, or people who had surgeries on their reproductive organ. So it tilts the cost of risk factors to affect females more than male. So that is in a nutshell risk factors. What are the causes? What are the things that can result into this topic that we are discussing today, the low back pain? One is trauma. You can have a trauma to the back. Trauma can be in form of gunshots, can be in form of road traffic accidents, it can be in form of domestic fall at home. It can be in form of fall at work. Somebody that is a carpenter fell from above while he was trying to construct the roof of a house. He may not have fracture. Hello, salam alaikum.
Alaikum salam.
Okay. So I hope you are going
Sorry,
with
sir.
me.
Please let us mute our mic so that we will not disrupt the lecturer. Please go ahead, sir.
So somebody that fell from the roof, sometimes it might be lucky that he didn't fracture the bones. It may rupture muscles. So such people are prone to have low back pain. Or sometimes you lift heavy weights and you strain your muscles. Yeah, the muscles go into spasm. So if a patient has such, they might have excruciating pain and necessitating presenting in the hospital. Another cause, which is very common, that we see a lot in our clinic, is the degenerative causes of low back pain. Why degenerative? Everybody gets old. Nobody wants to die young. I'm sure one of the prayers that Yorubas like in most of our mosques is that they don't want to die any form of death. Everybody wants to get old as possible. There's a price to pay getting old. The ligaments, they lose their power. The bones lose their strength. The muscles lose their strength also, so that everything becomes flabby. And when this happens, there's a lot of stress on the bones and the ligaments of the back. And so everything becomes another form of disease, or we call it disease of the hold. So degenerative, what happens there is because between two lumbar vertebrae, as in all vertebral bones of the back, we have a structure we call the disc. This disc is like a shock absorber. I'm very sure most of us who have one car or the other, we have at least a car's 4 shock absorbers. There's one of the shock absorbers that is not working. We'll surely feel it if you pass through a portal or you go over a bump. So the same thing happens in the human body. The disc in any human body starts to degenerate as early as 16 years of age. So if your age is 35 years now, your disc has been degenerating for the past 19 years. So and as older as you go, keeps on degenerating. So, and what happens is there's a shift of power. The shift of shock absorbing is now shifted to some other structures in the body, in the part of the vertebral column. And so many other things come out of this. And so what really happens in degenerative is aging and then wear and tear. And there's nothing we can do about those two. Wear and tear, there's no way you have to walk. Aging, nobody wants to die young. So another cause of low back pain are infections. There are two most common infections of the lower back, which is related to the spine. One of it is TB, tuberculosis. I'm sure most of us will have heard about tuberculosis before. We are radiographers, we are conversant with pulmonary tuberculosis, the one that affects the lungs. So we also have tuberculosis of the spine also, that affects the bones of the spine. So it can give excruciating pain. And it's a long disease, it's a chronic disease. It takes years for it to come out. Tuberculosis, there are also bacteria that can also cause diseases in the spine that will cause pain. So there are questions on that. We'll expatiate more on that. Following this are tumors. Yeah, the tumor can be blood or in origin. For example, the patient has multiple myeloma. It's a blood-related tumor or cancer. The cancer can also be of bone origin. So that means the vertebral column, the vertebrae themselves, or the ligaments, they can form cancer, or it may be from nerve origin. So because in the spinal cord, we have nerves there. These nerves can be the origin of tumor in the back. and they can generate pain in the lower back. Also, we have other causes of back pain, like metabolic diseases. The one we have discussed before, we have talked about osteoporosis. Osteoporosis is most common in elderly females, especially after they have stopped menses. So because estrogen has stopped, maturation of bone will stop, and then bones become weaker and become like biscuit bone. And so they generate a lot of pain because bones are also innervated by nerves. Then cause of pain in the back, lower back, can also be congenital. It's not very, very common, but we see it once in a while, whereby the bones of the back are malformed from birth. So the person is given birth to, he or she has a malformed backbone. So from birth. So sometimes the bone that is supposed to be as a whole, part of it will develop, the other part will be missing, or part of it will develop well, about half of the other part will develop well. The bone above and the bone below, they will be matched. We call it block vertebra. So people that are such, they will complain of pain as early as possible in life, and until they specialists actually find out what is happening, they might complain of pain throughout to their old age. One other cause of back pain that is very, very, very uncommon is the one from autoimmune disease. What we mean by autoimmune disease are diseases which are, how do I describe it? It's like the body is fighting itself. Body is producing antibody against itself. So the most common one is the one we call ankylosing spondylitis. Ankylosing spondylitis. In this disease, the whole bone of the back are fused together. They are fused together. The whole bone of the back, from the pelvis up to the neck, such that what they call those people, they call them bamboo spine, that they are bamboo spine. They can't flex their back. They can't extend their back. They can't turn their neck. So just like a bamboo. So this, in a nutshell, are just the few of the causes of low back pain that I can, because of time. So how does it present? How does it present? Sometimes the pain can be of somatic origin. Sometimes it can be of nerve origin. What I mean by somatic origin is the pain is not generated by compression of nerve. So it may be related to ligament, to muscle, to bone. So, but if it is of nerve origin, that means nerves are compressed. So we see all sorts of presentations. In Yoruba, we call something paja. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. We are with you.
Yeah, so there's something they call paja in Yoruba. I'm sure some of us will have experienced something like that one time or the other.
Exactly.
So how does it occur? How does it occur? Sometimes some people will tell you that they feel like electric shock in their thigh or their leg getting to their foot. Sometimes some people will complain that they feel peppery sensation. Sometimes it is burning sensation. Sometimes it's like they have somebody they had injection, and nobody's actually giving the person injection anyway, but that's what it feels. So people present like that. Sometimes they will tell you that it's actually like somebody is hammering their bone. That's the type of pain that they feel. Sometimes the patient will tell you that he's having spasm, as if he has played ball for a long number of hours and the muscles are contracting. So patient presents in varied way. Some people will tell you that they are heavy, their legs are heavy, that it becomes difficult for them to lift their leg while they are walking. Sometimes some people will tell you that slippers drops from their foot. So that is nerve origin. Most of the time, if it is pain alone, because pain is in varied ways. All these ones I'm talking about, they are forms of pain. Some other form of pain, we call them neuropathic pain because they are nerve origin. The other type of pain is somatic pain. And those are the ones that looks like somebody gives you a knock, or you have a muscle rupture, or things like that. So those are the types of pain that people complain about. Then patient will tell you that it's difficult for him or even him or her to sit for long, stand for long, walk for long. You ask some of them, how many NEPA pole can you walk before you are likely to sit down? So they will tell you maybe 1 NEPA pole, maybe 2 NEPA pole, because of the type of pain that they feel in their back or in their legs. So sometimes, or most of the time, patient comes to you and is complaining of leg pain, thigh pain, leg pain. Most of the time, if it is not from the hip, it's most likely from the back. Most likely from the back. So those are the ways by which this patients presents. We should also know that low back pain is one of the most presented complaints in almost all clinics in the world. Is one form of complaint that people use to stay away from work, to seek for gratuities at work. So common all over the world. And younger people also have started to present with this problem because of maybe because of academics, maybe because of the type of job that the person is involved in, or because of, yes, most of the time it's because of the job. Also, most computer analysts, people who are cashiers at their places of job, or things like an accountant. So they also present with such a complaint among the younger age groups, which is not very common some years back. So what do you do if the patient complain about this? Most of the time, when the patient comes with low back pain, after taking history and examining patients, most of the time, most patients will do well on analgesics. Most of them will do well on analgesics. So if they don't do well on analgesics after, say, about 4 to 6 weeks, and the patient comes back, then we'll request for x-rays of the lumbosacral region. And whatever we see there, we make our judgment. Sometimes we may need to go higher to do MRI, that is magnetic resonance imaging, to find out what is happening to the spinal cord, to the nerves, and from there, we can take it up if patient will benefit from any form of spine surgery, as it may be. So I think this short presentation should be, should be enough for us. If we have another question, then I can expatiate more. Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Jazakumullah khairan for that beautiful and short and encompassing presentation. I'm sure we have all listened carefully, and like for me, I've been noting down some things, and I'm sure some of us too have noted some things down. So now if we have questions, let us signify it by raising up our hands so that we'll be orderly. I'll call the hands one after the other. So please kindly signifies if you have any question. Okay, pending the time people will start to raise their hand, I have some questions. Okay. Number one is that what advice are you going to give to majority of the people you have listed that have these issues are people with sedentary work, in which many of us are actually involved in. Many of us work in the offices, working as a secretary, computer analyst, and now computer is taking over virtually everything. So we take time in using our computer to do a lot of things. So what advice can you give to us as people that are working as a sedentary workers? That's number one. Number two is that people have, while we are young, we used to hear, excessive sex used to cause low back pain. And from what you have presented, you've not mentioned anything like that. So I wanted to know, is it is it not applicable? And how does it go? And lastly, from my own side, you mentioned this drug prednisolone. I know of some people that they recommend prednisolone for, like people who are having skin rashes, people that are having patake, and some other things. So, how do you advise such kind of person? Is it that you will tell them not to use it in order not to have back issues, or how do we go about it? So, these are the three questions I have. I think maybe if you answer them, then I can now call the people that have raised that are signified.
Okay, so for the sedentary work people, what I usually advise is don't sit more than 45 minutes. Stand up, walk around, exercise your back.
Okay.
Say like 10 minutes, and then you can sit back again and then continue what you are doing. So time yourself. Have a wall clock in your office. Look at it. Once it's 45 minutes, stand up, walk around, exercise your back. If you can do press up, you can do your press up in your office. If it's not possible, just walk on your back, walk around. Sometimes you can even stand and be walking while you are standing. It's not good to be sitting for long. It's not good. It's not good for the body.
Okay.
So the second one on the issue of sex, I've never read it. Maybe those people that says if they have a journal that one can read, they can.
It is not.
It's a common saying, Abi.
Yes, it's just a common saying that something like that.
It doesn't have a scientific basis. But what we know is whatever you do, whatever is said too much harms. So whatever we are doing as the Muslim must be moderate. So once we are moderate, we won't get harmed. Anything one does that is excessive will cause problem. Even if you drink water, as good as water is, if you drink it too much. So that's the way I see that issue of sex. If it's moderate, there shouldn't be any problem. And of course, as you age, you also know that you have to reduce some things. So, and the third one, prednisolone. Yeah, if a patient is on prednisolone for a particular disease like skin prescribed prednisolone for, like psoriasis, vitiligo, things like that. Yeah, it will be guided. The person that's going to use that prednisolone is going to be a guided prescription, not just be taking it. We have patients that have been taking prednisolone for the past 2-3 years. So, and it's not as if they are using it to work on any other disease entity in the body. So it should be guided if it's used. For most people that I'm talking about, nobody prescribed it for them. It's just one friend or the other, peer pressure, one friend or the other that prescribes it to them. And one thing about this medication is, if you take prednisolone, no matter any type of pain that you have, you get relieved, and you feel that it is working, but it's actually destroying your cartilages and destroying the bone. So that's the problem with it. There's some other problems, though. Hypertension can give diabetes. Those are systemic problems. Hypertension can give. So yeah, it's really.
Okay. I have so many hands, and I'm going to try as much as we can to make sure we cover the hands. So please let us go straight to our point so that our doctors too can be able to give answers to them immediately. The first person on my own list here is Malam Kozim Badejo. Please go ahead with your question. Unmute yourself and ask your question. Malam Kozim Badejo. Please unmute yourself and ask a question.
Hello.
Hello, yes, we can hear you.
My question is that, can massaging and physio help in treating low back pain?
Thank you.
Hello?
Yes, thank you. I think we've had the question.
Yes, sir.
Yeah. Another person.
Okay, another person. Okay, my Malam Abdulhakim Omoloju.
Assalamu alaikum. Yeah, assalamu alaikum. Yeah, doctor, I want to ask, is there any relationship with taking much of sugar? Does it really affect does it really cause waist pain? Because, you know, they will always say, I have pile, that's why I'm having waist pain. Does it have any scientific proof? And if there is, so what can we use? Thank you.
Okay, then the last person before the doctors respond is Ajia, our sister Ajia Mujibat Akorede. Please go ahead with your question, ma. Mujibat Akorede, sorry. Ajia Mujibat Akorede, please go ahead with your question. Unmute yourself and go ahead with your question. Okay, pending the time show.
Okay. I have been able to unmute myself. Assalamu alaikum.
Wa alaikum salam takatu.
I want to say a very big thank you for the opportunity. Actually, my first question is about the effect of sugar and on the back pain, and that question has been asked. The second one that I want to ask is, what is the relationship between the back, because it's something that, you know, that have been having on and off and all of that. So, but some people or some medical practitioners will say that it has to do with age, or it has to do with you know, stuff like that, or when you have ulcer, that it's, you know, it has effects. Like, can there be kind of like maybe permanent solution to it? So what's the permanent solution or the way out?
What?
So the back pain, especially the one at the upper parts or lower parts, and it's to the back pain. Like, is it because of age too? Like, at what age, when you get to a particular age, one cannot do with
for a man?
Sir?
For a woman or for a man?
I'm a woman.
Is it you that? Okay, it's you.
Okay. Yes, it's me.
Okay. So
doctor, please go ahead.
These questions.
Yes, yes.
Okay.
Yes,
massage is good. Massage is good. So, but if it's good, yes, but not the type of massage that the Hausas do, that they will stand on somebody's spine.
Okay.
Not the hefty man will stand on your spine and will be stamping your spine. That one can give you paralysis. So not that type of massage. The type of massage we are talking about is those professional ones that use their hands. Just the one that the physio does, yes. one can also go for the training. It's very good. Massage is very good for muscles generally. So then physio, yeah, there are exercises for the lower back. You check your Google, check your YouTube, just write low back exercises. You see a lot of them there, a lot. You can even see sessions that you can follow. Yeah, so these two are very, very good. Those are the first line of management that we give our patients when they come to clinic. We give them drugs, we give them physiotherapy, exercises to do. This when those ones fail, that's when we go higher to seek for some other investigations and see whether surgeries can actually solve their problem. So those two are very, very good, in good hands. The issue of sugar and the back pain. Yeah, I used to hear about it, and Yoruba will call something jeji. I'm sure some of us have heard about that before, or we call it what's the common name now? So I want to those people in markets that they used to sell. Pile is just one of it. There's a name. There's a name called things like that. They are just a misnomer. Yeah, I will call them misnomer. That, for instance, the issue of sugar and pie. Yes, if you take sugar, some people may react to it, and they may have their anus protruding. That's what we call pile, hemorrhoid. Pile is hemorrhoid. Pile, if they take sugar or they take some form of food, they may have hemorrhoid. It's not actually the hemorrhoid that's causing the problem. It's the reaction of the body. I really can't get any association between the sugar and that thing, but some people complain about it, and when they take sugar food, that they have pile. But I'm sure they have that pile before. I'm very, very sure about that they have that pile before. So there is really nothing that one can relate between the sugar and the pile. I'm sure they have that pile before. Maybe it's just exaggerated when they take the sugar. And of course, because the anus comes out, is protruding from his place. It's possible this is what is causing the pain, the low back pain. Because it was a movement of tissue from one place to another. It may be because of the pain. It's just like you go to toilet and you defecate a very solid, hard stool. It's possible most of the time you have a back pain when you stand up from the toilet. So that may be the relationship. Natural fact, scientifically, there's nothing that proves that if you take sugar, you actually have a back pain. And what we call jedi in Yoruba is a myriad of pathologies, a lot of pathologies that are it's like a syndromic disease. That's what I can call jedi. You take a lot of diseases and now clump them together into one disease identity. And these things are not the same. Person has erectile dysfunction, you call it jedi. Somebody has diarrhea, call it jedi. Somebody is constipated, you call it jedi. Somebody has pile, hemorrhoid, you call it jedi. All these diseases, they are different pathologies, different causes. The treatment is different. So, in natural fact, we that have gone to school, we should disabuse people, we should educate them. These things are different. They don't have the same treatment. They don't have the same cause. So they shouldn't be clumped together. Then we'll talk about low back pain. Low back pain. Yeah. So as I've said before, your lifestyle is first thing that you should look at. Are you a sedentary worker? If you don't know, check yourself now. How many hours do I use to sit? How do I sit? What type of furniture do I sit on? Very, very important. When I sleep on bed, how do I sleep? Do I sleep awkwardly? When I lift object from ground, heavy object, how do I lift it? Do I go down and lift it and come up with the object? Or I just bend down and lift heavy object? You should look at that. Very, very important. So all these things come out. So a female that is putting on weight, check your weight. Because your weight has a lot to do about your low back. So if you are the bigger type, your back, you have pain in your back. There's nothing you can do about that. When you share weight, you yourself, you feel there's a lot of load that's lifted up your back. Your knees also, they are at risk. If you are the obese type, your knees are at risk also. So those are the things that one should look at. And as one gets old, once you reach age like 40 years and above, there's nothing you can do about not having back pain. So you want to get old. You don't want to experience what the old experience. It's a joke. So you have back pain, but you can manage it. It can be managed. So exercises, you jog, things like that. You manage it. You want to have at all. That may be practically impossible for you to say you don't want to have at all. So that is.
Okay, so let me call other people. I have a sister.
Sorry, sir. We have some questions in the chat box. Maybe you can.
Okay, let's first of all call the people who are raising up their hand, and then if we still have time, we'll go to the chat box and take them. It's for us to be orderly. Yeah. I have Sister Fauzia. Please kindly unmute yourself and ask your question.
So thank you so much for the presentation. So my question is, does 5 times prayer, the daily prayer, salawat, have any effect on our back, especially the ruku? Or let me say the 5 times prayer generally. Does it have any effect on it
has positive effect on it.
Okay. Positively or negatively? That is
positively.
What I'm
Positively.
And how, sir?
It's an exercise.
Okay.
It's an exercise, so it will help you.
Okay, so can that be recommended as a form of exercise? Maybe to be doing more of salawats in order to prevent low back pain?
I won't do that. I won't tell you that one. I won't say something that you are using to pray, to worship your God. You now be having 2 aniyabi. You have an aniya that you want to worship God, and an aniya that is an exercise. So it's better you go on YouTube. You see low back exercises. Go and do those ones. If you want to do nawafi, who could do nawafi for Allah? Don't do it because it's an exercise.
Jazakumullah khairan for that. Malam Ismail, please go ahead with your question.
No,
Malam Ismail.
Assalamualaikum.
I
truly appreciate the presentation. So my question is, what is someone that is even when someone is working and the person usually stand all through? So and the person has been complaining of back pain. What can the person do as regards that back pain, and what can they use as in terms of medications for that back pain to be eased? So that's my question.
Okay. Malam Idris Olakpade, please go ahead with your question. Unmute yourself and go ahead.
I joined the program late. I want to ask, is there any relationship between someone that has a kidney problem? Does it have any relationship with low back pain?
Okay, then before you answer, let's take one more so that you answer the three together. Malam Yakub Alidu, please go ahead with your question. Malam Yakub. Wa alaikum assalam wa rahmatullahi wa barakatuh.
First of all, let me thank the doctor for this wonderful presentation. My questions are two. The first one is for people like us that drive long, because most times if I'm going to my state, I do stay from Kano. I drive down. And I do it. I don't rest until I get maybe local job. I'll just come down, take some walk, then continue to drive. I don't know if there's an advice that people like us can get from you. That is one. The other one is I heard some people say that your mattress do expire. That if it expires, it can cause back pain. How do mattress expire, and what is the remedy to that saying? These are my questions. Thank you.
Yeah. So, doctor, please go ahead.
So the first one is standing. I don't know how many hours does my brother use to stand in a day, and how does he stand? What type of job does he do?
Okay. Now, let's say like for 5 hours or 6 hours, maybe the person usually attends to customer and the person always stand up to attend to customer and to work.
What I would advise is start exercising. Start what I've said before. I said go to YouTube, look at back exercises, start to do them. If you can join a gym, join a gym. If you know how to swim, please do so. All this will help. It will help.
So what if is the person?
I don't have any other job for you now to do what you are doing.
Okay. What if the person is old? I don't know. Is it same exercise the person will be doing?
That's not the same exercise. Whether hold or not, it's the same exercise.
Oh, okay. No.
There are several types of them, several back exercises.
Okay.
So the issue of kidney, yeah, kidney can give low back pain. If the kidney has infection, yeah, we can have tuberculosis of the kidney. You can have some other infections of the kidney. You can have stone in the kidney, or if the kidney has cancer. So it can give low back pain. All these ones can give low back pain. So if we have issues like that, that is why it is good. If you have complaints like this and it's dragging to 6 weeks, try and see a specialist. We are so blessed these days that we have specialists among us, Muslims. Even if you can't get among Muslims, you get among Christians. Try and let us consult specialists. We should stop going to general hospitals where private hospitals where the doctor that owns the hospital behaves as if he knows everything. So the type of treatment he will give us will be substandard, because it's not possible with the amount of knowledge that is in the world today. Somebody will say he knows everything. It's not possible. So I think we should take care of that. To do something about that. The issue of mattress. Yeah, mattresses, they expire. So I can't tell you the number of years, but where you buy the mattress, if you ask the person that sells to you, he will tell you, he or she will tell you the number of years. They know. They tell them from where they buy it. Somebody bought a mattress about a year ago. There are 2 mattresses from 2 different makers. The person was told that the person was told that this one, no, it will expire in the next 15 years, and the price is 200,000. This one is 50,000. It will expire in the next 2 years. So you can pick anyone you like. So those people that sell mattress, they know the number of years for expiration. They know it. So ask them; they will tell you. So if you don't mind the price, so you can buy the one that the expiration period will be at least as long as possible. So it will help a lot. So, and then yes, mattress can actually worsen the back pain or even cause it. But by the time you are sleeping on your mattress and the impression of your body is showing when you wake up, so it will certainly give you back pain. That's why people like that will tell them, if you don't have money for another mattress, why don't you sleep on the floor? And when they sleep on floor, usually the pain is usually better with the analgesics that they take. Voila.
The person that is driving for long, sir.
Oh, my brother that drives along. Hey, I don't know what I can do. I don't know which advice I can give you, because you'll be doing that for how many years to come now?
I guess I've been doing that from, I think it's about from 2012 to date.
When is it going to end? When is it going to end?
Though I go once every year. Just mostly to go see my parents once every year.
It's just once in a year.
Yes.
No, that one is not a problem. We have, when we say long distance drivers, we are saying people that takes it as like their daily job now.
Okay.
Those are the people we are talking about, or people, or these Alajapa ladies. Those ladies that follow trucks and trailers to long distances. They buy their goods and then they come back. Those are the type of people that we are talking about. People that take it like is a livelihood, because it's a repeated injury to the back. Even them, it takes about 15 to 20 years for it to manifest. Not that they do it for 5 years and it comes up like that.
Okay, doctor. Okay, now I understand.
Yes.
So, alhamdulillah. Thank you very much.
So, alhamdulillah, let's take the last two questions we have. Then we'll move to the chat, inshallah. We have Malam Ismail Adebayo. Please unmute yourself and go ahead with your question.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Now, my question goes thus. Does low back pain have anything to do with swollen legs, which makes the person not to walk freely, make it hard for the person to walk? That's my question.
Another one.
Okay, then the next person is the last one is Imam Ismail Abdul Qadir. Please go ahead with your question. Unmute yourself and go ahead with your question. Sorry, we can't hear you, Imam Ismail. I can't get that. I don't know. Maybe I'm the only one. Can any other person get what he's saying? I can't get him.
No, we can't hear him.
Okay. Imam Ismail, please, if you can type it on the chat box so that we can get it, or maybe you change your location. Then pending that time, please, you can quickly go ahead with the first that question, Doctor.
Swollen leg or swollen foot? Is it swollen leg or swollen foot? The person that asked that question.
Okay, swollen legs. Swollen legs.
Leg or foot?
Legs.
I don't understand what you mean by leg. See, in me, I'm an orthopedic surgeon. There's the buttock, there's thigh, there's leg, and there's foot. Which one are you talking about?
Foot.
Thank you very much. The person has foot swelling. The two feet, Abi.
Yes.
Okay. So one of the first things that person must make sure or take care is the blood pressure. If the blood pressure is not controlled, that is the person that has hypertension. So such a person may be tilting towards heart failure. So because once you see the 2 foot that are swollen, means that the fluid in the leg is not going back into the circulation. And what the common cause in this area is heart failure. So that person must see a cardiologist as soon as possible. As soon as possible. So they are the one that will manage the person. And if there's another thing that is causing it, another thing that can cause that is kidney failure can also cause that. So it's not normal at all that you see the 2 feet being swollen, unless of course the person is pregnant. Is it a pregnant lady? Is the person pregnant?
No, not pregnant.
Because the pregnant ladies also have it. Even the pregnant ladies, because there are some issues with the kidney at that time. That's why they have it. So I would advise that this person you're talking about is either hypertensive and also as soon as possible.
Okay, sir. So, Doctor, I think if I can add to that. Yes, I think if I can add to that, is the kidney that you have mentioned. When there is problem with the kidney, being the fact that it is attached towards the exterior part of the back can also bring about pain. And when the kidney is not functioning very, very well, it can also actually lead to edema. So I think maybe that's why there's that kind of relationship. I don't know what you will say about that.
No. If for somebody to have the 2 feet swollen, shows that the circulation is not working well.
Okay.
It's the circulation that has problem. Yeah, so he said most of the time it's heart that has problem. Most of the time.
Okay.
Then sometimes for it to get to the feet, in kidney failure, first thing that you see in the patient that has kidney failure is facial puffiness.
Okay.
Yes, that's the first thing that you see. By the time you get into the foot, it's worse.
Okay.
Yeah.
So one of the questions we have from the chat is, what about cervical spondylosis? Is it related to the spine? And
no,
does
it's
it
not
have
related to it's not related to this topic. So you can take another day for that.
Okay. Then another question is, I want you to talk about the part of paja and its effect. I didn't hear that part well. The voice was breaking at that time.
I don't really know what. It's just a symptom that shows that nerves are compressed in the spinal cord. That's just it. Not the type of paja that you feel when you sit in the water closet for a long time. That one happens to anybody, everybody, whether you have back pain or not. This one we are talking about is you are not sitting on water closet. You are just sitting in your place. You are walking around. And you are feeling peppery sensation. You are feeling burning sensation in your leg. You are feeling shock, electric shock in your leg. And those are the ones we are talking about. Those ones are.
Okay. Another question is, what type of lifestyle adjustment can be made for one who have right nail pain always, anytime?
Right.
I think that's what, right nail pain always.
What's the age of the person we are talking about?
It is a question that was posted on the chat box, so I don't know if the person can unmute his or herself and answer the question of doctor.
Need to know the age so that because age will relate to what we can do. What type of advice we'll give the person.
Okay. Then another question says, what can be good remedy for someone who is having back pain? He has mentioned a lot, exercise, analgesic, and some other things like that. So we can just take that. What is lumbar and
massage?
Massage, yes, and massage. Yes, somebody is asking about lumbar spondylosis. He has said that will be for another day.
No,
then
lumbar spondylosis is related to this one. The one that you
asked
for cervical.
Okay. Please go ahead with. He said, "What is lumbar spondylosis? And what are the possible solution or remedy?"
Okay, so the lumbar spondylosis is the degenerative cause of low back pain. Hello? You are going along. So, you know, I talked about the causes of low back pain. So the degenerative type is what we can say is lumbar spondylosis. What we mean by lumbar spondylosis is that the disc, which I call the shock absorber, they have degenerated. There are some other ligaments in the spine. They have also degenerated. So everything has collapsed. So that is what we call lumbar spondylosis. So it's like a collapsed back. A back that is that doesn't have strength again. It's only muscles that are keeping it alive, that are keeping it straight. If the muscles are not there, it will either fall on itself forward or fall on itself sideways. So if it falls on itself forward, we call it spondylolisthesis. That is the vertebral column above is shifting on the vertebral column below. If it falls to the side, we call it scoliosis. So it's like you have a concrete block that is on each other. It's not trying to, like you have a pillar that is bending sideways, or you have a pillar that is bending forward. You know that it's an imminent sign that that house is is going to fall. But because there are still muscles there, muscles will still keep it in that form. But it's very, very, the pain is very, very excruciating unless that person has surgery.
Okay. I think the last question we are going to take for today is, what is the cause of back pain during menstruation?
That one, the pain is from the uterus. The pain is from the uterus. Hello?
Okay. Hello, I'm with you. Yes.
And that is why if you give such people, if you give them non-steroidal anti-inflammatory drugs, like, for example, mefenamic acid, things like that, takes away the pain. Because once you resolve the pain that is from the uterus, it's like the uterus is contracting at that time. It's contracting at that time. So once you give it non-steroidal anti-inflammatory drugs, you see that the pain will go down. The pain goes down. Most of the time, at least 90% of the times, it takes away the pain. So, and some people say it's as a result of hormonal changes, because we found out that people like that, once they get married, and the cause of hormone changes after marriage, after having regular intercourse, but the person is pregnant, hormonal changes occurs in the woman. The pain goes, and they don't experience it again. So we advise our sisters to get married as early as possible.
Okay, inshallah. I think we still have some people who want to have a section with you, and we don't have that time because now we are exceeded the time we budgeted for this program. I don't know how we can go about it. Is it that you give us your mail that we can communicate with you and some other thing?
Yeah. My number's with the Malam that connected me with you, so they can get me on WhatsApp.
Okay. Okay. Jazakumullah khair. And I think that we are going to do for some of us that we can't take our questions or ask our Malam, I think Malam Abdulaziz Abdul Salam, to give us the number so that you give him WhatsApp messages, please, not call, please. WhatsApp messages. Then if it warrants that you have to call, then you can now call in, because sometimes they are going to be in the theater, they have a tight schedule. Please let us do that to make life easy for our brother and for ourselves as well. So with this, we'll come to the end of today's section, and we really appreciate the doctor for the beautiful presentation you have given to us. It has generated a lot of questions and a lot of things that have been made clear to us. Jazakumullahu khairan. And without taking our time, we would like to quickly call on Malam Habib in case there is any information for us before we go to the vote of thanks. Malam Habib, any information for us?
Yeah, okay. The information is that this is a regular program, a monthly program that we normally have every fourth Sundays of the month. Inshallah, for the next month, we are going to communicate us the topic. We normally take topical issues burden in our society. So
we can't hear you again. I think we lost him. But basically, okay, it's still there. It's network issue. But basically, what he's trying to say is that it's a regular program.
Topic for.
Okay, inshallah. Thank you so much. So I will call on one of our brothers who is with us here to help us appreciate our presenter and every one of us who have been here. It's no other person than Ustaz Ahmad Akorede to give us the vote of thanks. Ustaz Ahmad Akorede, please unmute yourself and give us the vote of Wa alaikum assalam wa rahmatullahi wa barakatuh.
So we thank Allah subhanahu wa ta'ala who has made this program a very successful one. And we want to use this medium to appreciate our consultant, our doctor, who has given us, so inspiring and well-informed, talk with respect to how to manage our back pain. We pray Allah subhanahu wa ta'ala to spare his life and continue to guide him. We pray to Allah to safeguard him and his family and to bless all his endeavors. And to every one of us too, we say Jazakumullahu khairan kathira fi dunya wal akhirah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Inshallah, I'll call on Malam Dawood Adedeji to give us the closing prayer. Malam Dawood Adedeji to give us the closing prayer. Malam Dawood, please, if you are talking, unmute yourself and give us the closing prayer. Okay, to save our time, we'll call on our elder ones, the Papa Lolo himself, no other person than Malam Abdul Karim Adinekon to give us the closing prayer.
We thank Almighty Allah for his mercy on us. We pray to accept. We pray to Almighty Allah to accept this that you have done out of better from us. We pray to count it as a part of our good deed. And we say the particular current to our honorable lecturer. So, assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Subhanaka Allahumma wa bihamdik. Nashhadu an la ilaha illa anta wa nastaghfiruka wa natubu ilayk. Wal asri, bismillahir rahmanir rahim. Wal asri, innal insana lafi khusr. Illa alladhina amanu wa amilu salihati wa tawassaw bil haqqi wa tawassaw bis sabr. Subhana rabbika rabbil izzati amma yasifun. Wassalamu ala al mursalin. Alhamdulillah. We appreciate you all for coming. Jazakumullahu khairan.
الله خيرا كثيرا.
اللهم يا مقلب القلوب ثبت قلبي على دينك. اللهم يا مصرف القلوب
آمين.
على طاعتك. بسم الله على ديني ونفسي وولدي وعلي ومالي.
آمين.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank to our great lecturer.
Oga Yakubu. Oga Yakubu. You too much.
Jazakumullah khairan. Thank you.
Thank you.
That's his family.
Inshallah, I'll do that. Assalamu alaikum.